This is life.
You see another boy?
From the moment you are born to the golden years, you live for those precious moments. Your wedding day, completing a marathon, or simply enjoying a day out in the park. Nothing is more important than making sure you are in great health. Welcome to Pronger Smith Medical Care. For over 6 decades, Pronger Smith has provided medical care in various areas in the field of medicine. With 2 locations based in Tinley Park and Blue Island, our mission is to provide high-quality, cost-efficient healthcare services to a large and diverse population in the South Side and Southwest suburbs. Although the medical field is evolving, there are providers across the country that still rely on an endless paper trail of medical records, at times making sharing information between doctor and patient difficult.
There's too much of a chance that someone may forget something, someone may miss something. There's too much of a chance that one physician thinks the other physician is taking care of a particular issue.
There have been instances where patients' entire medical records have been lost due to human error, due to storms, lost access to precious information.
It just leads to better medical care if we can all communicate on the same plane. And I think that is lost on paper many times because you cannot retrieve paper. And sometimes when your office is closed or it's not accessible 24/7.
Pronger Smith Medical Care is in constant pursuit to give its patient effective and efficient health care. Thanks to today's technological breakthrough of new computer applications and the ability to store mass information electronically, Pronger Smith, along with the help of Blue Cross Blue Shield, is proud to introduce Patient-Centered Medical Home. Imagine, no matter what your age is, which doctor you see, Pronger Smith now electronically stores all your information, giving all doctors, nurses, and staff members an easy, transparent approach to retrieving your medical information. In addition, giving you, the patient, free and easy online access to view your medical history. The result, better coordination of care for patients.
Medical home is focused primarily on prevention. That's where the bulk of the services that are rendered will be. The staying well piece of medical home. Then the getting well piece will be focused on that chronically ill population that basically needs a little extra attention, a little extra care to be able to do their best.
As part of our patient-centered medical home, our patients are able to access their record by going onto the internet and accessing their own account after they've signed up for it through a patient portal. Through there, they are able to go in under a secured fashion to see their medications, their allergies, their labs, their diagnoses, and if there are errors in there, they are able to speak with their physician.
Because it's a patient-centered medical home, all of our information is collected in one place, so it's extremely easy for us to access that information, and it makes caring for the patient that much easier.
If a patient goes into labor preterm, we would have the ability to check and see whether or not the patient's cultures were positive or negative as to whether they would require antibiotics prophylactically.
The patient-centered medical home will rest in the fact that the patients are going to be engaged.
I was given a prescription for, I believe what it was, high blood pressure a while ago. I haven't taken it. To be honest, I forgot to get it filled. I don't know where I could access that information. I was seen here.
With our patient-centered medical home program now, all of the doctors in Pronger Smith have access to all of your medical information, and then we also have a regional health record where you're able to go online and access your patient information for yourself.
And I just go to ProngerSmith.com for that?
You can go to ProngerSmith.com, and then there's a link and it'll give you all of the information to access your regional medical record.
Okay, and you can access my medical information for me here today?
I sure can. I can go into your chart right now and access any information that you need.
Perfect, yeah, that would be great.
Anywhere in the world, you'll be able to pull your record up, and it's selected information. It's your meds, your allergies, your problem list, and some selected labs that the emergency room doctors would typically want to see.
It will avoid any unnecessary tests that might have been done recently. It's very helpful to the other physicians that are taking care of the patient because they have access to the information, and the patient sometimes they don't know what medication they are on, they don't know their medical history too well, so it's very helpful.
We have all of the information about the patient readily available to us, and we can see how other providers on the healthcare team, how they're impacting that patient's health. It helps us to deliver more comprehensive care in a safer manner.
Patients have the ability to sit for an extended period of time, to actually be a part of their treatment plan, have a say-so in what the next steps are on their treatment plan, and are watched a little bit closer if they need complex case management by our care coordinators.
In many cases, patient-centered medical home begins with the Pronger Smith primary care physician.
It's important to see a family physician to start off with. We're better trained to pick up on abnormalities. We'll know where to send you for further treatment if you need it.
Women's health and patient-centered medical home will also work hand in hand.
One of the most broad areas, because you've got OB-GYN, for instance, for their years when they're having children, through change of life when they're not. Women probably get the best care in our system as it exists today just because of those facets, so they tend to see a physician more frequently.
Before the disease goes too far, we can catch it. For example, mammograms. I've caught many small masses before it became, a full-blown cancer.
Screening is so important. It allows us the opportunity to catch the disease early if anything is occurring. The treatment options are much better if caught early, and that will allow women to have a healthier lifestyle later on.
Dr. Arnold Bolase specializes in the field of endocrinology. He also understands the importance of patient-centered medical home and how it's beneficial for him and for his patients.
Patient-centered medical home is perfectly suited for certain chronic medical conditions, and with diabetes, I think, being at the forefront of that. The reason is because this is a lifelong condition for the patients, and it's something that as human beings, it's very easy for us to sometimes forget that we need to incorporate, that medical problem into our lives. So having a patient-centered medical home helps to remind patients that we want you to go on living your life, but we want you to incorporate healthy habits and proper monitoring of your condition.
What we eat, our lifestyle,
Patient-centered medical home will also give Pronger Smith nutritionist Janet Arenas a clear understanding of how to best create a nutrition plan for her patients.
I will communicate with providers, and we will keep in touch with the providers so that that primary care physician is aware of what is going on with the patient at home, their lifestyles, their diet, their exercise routine, and we can get that complete package for that patient.
Dr. Joy Jester has been practicing in the field of dermatology for over 20 years. She says patient-centered medical home is an effective way to learn more about a patient's medical history, helping her make a better, more thorough evaluation and diagnosis.
Most of the time, their other medical problems really aren't involved in their dermatologic care. But there are exceptions. In those cases, the other things that are happening to them in their medical life are greatly impacting their dermatologic condition. Because if I have a patient who's already hooked into the Pronger Smith system and we discover they have a problem, say an elevated blood pressure, or there's a medication that we think there's a reaction to, it's very easy to communicate that to the doctors here.
Patient-centered medical home is one giant leap in giving the patient and the doctor immediate access and a thorough understanding of a patient's medical history, and the ability to share the information with other doctors and nurses at Pronger Smith to ensure 100% transparency between Pronger Smith Medical Care and its patients.
With patient-centered medical home, the information, the focal point being the patient, allows a deep dive into data so that we can identify that patient's very specific and explicit history.
Just to be able to go into our electronic health record and be able to access a chart, if it's a Tinley patient, Blue Island patient, wherever that patient may go, we're able to answer questions from the hospital to other facilities that may be treating the patient. I have all that information right at my fingertips.
Patient-centered medical home is a way of our patients looking at this as their home for coordination of care, so that if they do end up in Arizona or Australia, anyone could have access to their medical records through the patient saying, you can have secure access to my account.
This is life, the moments we all live for. Here at Pronger Smith, our job is to make sure you are living life to the fullest. That begins with patient-centered medical home. What is patient-centered medical home? Patient-Centered Medical Home is not a place. It is a whole team of providers and staff working together to provide excellent medical care. Patient-Centered Medical Home consists of many components working together, providing unparalleled excellence of care. Your primary care physician works with you to establish a plan of care to monitor and address your healthcare needs. Your personal care coordinator. Your personal coordinator is your personal contact for your team of professionals. This is a registered nurse that will work with you to help navigate you in your healthcare needs. They can inform the other people within your team of changes in medications, your schedule, check your test, plus they make sure all of your team is informed and all on the same page. EMR, Electronic Medical Records. Electronic medical records replace paper files and charts. All your records are stored in a secure virtual location that can be accessed by your complete team of professionals, as well as you, through the use of our secure online portal. With EMR, your medical information can be viewed quickly by the people who need to make decisions about your health. It also reduces costs for duplicative testing because all your tests are available to you and your healthcare team. The benefits of Patient-Centered Medical Home, your personal primary care physician with access during and after office hours. Healthcare tailored to your specific needs and concerns. Centralized electronic database of your medical records available to you as well as your entire healthcare team, which may include extended family members as well as caregivers. Better communication between primary care providers, nurses, pharmacists, specialists, home health care, and you. Quality that meets evidence-based healthcare guidelines. Provides self-care support and community resources. Early detection of drug interactions, allergy alerts, or specific needs even when you are unable to answer for yourself. Increased sense of control over your health. Stronger partnership between you and your healthcare professionals. A longer, healthier life with the best outcomes possible. Is keeping you healthy.
I'm very proud that Pronger Smith has been at the forefront of entering this new era of electronic medical records. Patients are expressing gratitude that now they can go directly to their pharmacy and pick up their medications without a wait. They're finding that it's easier to have communication between their different doctors. And it's making the patients feel less nervous because the patients aren't being asked to come up with every small detail of their medical care, which is not reasonable for a layperson to even understand and be able to relate.
Not only do we get to know you over the years, but we get to know you and your family. We have access all of your medical records in one location. That gives us more information, and more information is what we really need to give recommendations on how to take care of you and your family best.
Pronger Smith Medical Care, with locations in Blue Island, Tinley Park, and coming in 2012, offices at the Silver Cross Hospital Medical Office Building in New Lenox. We welcome you to the Pronger Smith Patient-Centered Medical Home.